Hi everybody, this is Pete Delatorre, the CEO of Camacol Doral, and welcome to our very first Camacol Talk for 2022. Today's program is brought to you by the City of Doral, Baptist Health South Florida, City Place Doral, and Career Source. We're kicking off this year with conversation regarding COVID, of course, but more particular about boosters and vaccines. With us today is Esty Trimino, who is the Director of Medication Safety for Baptist Health South Florida, who will enlighten us with real information on what's going on with vaccines and the boosters. All right, as promised, with us here, it's Esty Trimino from Baptist Health South Florida. How are you today?
I'm great, Pete. How are you?
I'm doing terrific, and the topic today is one that's front and center with all of us dealing with the entire COVID pandemic and everything going on. We've been talking vaccines and boosters, and you're going to set the record straight of what's going on and make sure that we have the right advice and guidelines on what we should be doing right now. But before we get into that conversation, if you can tell us a little bit about yourself, your background, and what led you to do and play this role with Baptist.
I a little bit about myself. I'm homegrown from Miami, Florida. I've been here since I was born. And I always knew I wanted to be a pharmacist. So ever since I was in high school, I knew I wanted to do that. So became a pharmacist. I've been a pharmacist now for about 20 some years. I don't want to date myself, but love pharmacy. I love my profession. Luckily, moved from, clinical practice from an emergency room setting and an admitting setting to administrative roles throughout my life. And now I'm with Baptist and I'm doing medication safety and quality. And as a pharmacist, that is what we do, is take care of our patients and make sure they're safe when they're taking medications.
I bet you it never crossed your mind when you made the decision to follow this career path that you would be faced with what you've been faced with the last year or so. Um,
Yeah.
is this is something that, well, this whole COVID thing has caught everybody off guard. I mean, almost 2 years ago. But for you, I guess it tested you in your early years in your career in a way that you never would have thought, right?
Yeah, Pete, it was last year for, when the first pandemic came in December, of last year. And once we started getting the vaccines in, I think that was like history in the making. I don't think anybody would have seen that, being done. I mean, Baptist was at the forefront of vaccines in the community. And I remember, getting my vaccine on December, 17th. I'll never forget that date. And it was just one of those life-changing events. And ever since then, we just keep learning and just how medications are advancing with the pandemics and with the different variants that we have, and how medicine works and how we're taking care of our patients has just changed. Every day is different. I mean, every day is something new. Vaccines and boosters and medications coming out. I mean, there's just so many new things and upcoming therapies, and everybody pulling together as a community that really has made this different.
Well, we've been hearing about vaccines, and I've been vaccinated. I've got both of them myself. Now it's about the boosters. Can you share a little bit about the role of boosters and what we know at this point, and why is our vaccines not quite enough to do the job?
Yeah, I mean, vaccines are definitely the best way to prevent severe illness with COVID. So being vaccinated and having your series is the way to go. So you're doing the right thing. Everyone who should do that. But as we know, and the studies are showing, as we more of our patients or more of a population is getting vaccinated, we see that there's a decrease in some of the effectiveness of the immunity of the vaccine. Especially happens like with patients who are 65 years or older, or patients who have other conditions that make them immunocompromised or are at risk for infection. So in those patients, the booster was recommended. And what we've seen is a lot of the studies have come out, and CDC actually is a great resource that you can really read about the boosters and the effects of the boosters, but very cutting edge. And you'll know that with the boosters, you have definitely a very high incidence of decrease of severity of COVID. I mean, you still can get COVID, but you're not going to progress to that progression that we saw with the various other variants.
Hmm. Now we're hearing a lot of stories, and I'm not, I can't verify the facts, but even with the vaccine, uh, we're seeing folks that are not just getting COVID or getting COVID a second time, but being hospitalized. Why do you think that's happening?
So there are patients who, the patients that we're seeing that are coming in, even with the vaccines, they have most of the ones that we're seeing with severe illness have some immunocompromised or some other factors that may have influenced, or it could have just happened. I mean, we do have patients that we see that are hospitalized, but what we're seeing is really the patients who are vaccinated, who are boosted. Those are doing really well. I mean, they may have other symptoms, comorbidities or things like asthma or other things that predispose them to a more severe infection. At least with this variant, we have less ICU or critical care patients than we did with the Delta.
Are you hearing a lot of the after effects of individuals taking vaccines, and again, the things that are happening to them, lingering effects? That's what I keep hearing a lot. Or what do you hear regarding that?
Yes, we have, we, really, we have seen that with the vaccines that we have, for the patients that we've had given vaccines, and we keep a track record of all of our patients coming in through our emergency rooms or any reports we get. We do report vaccines to something called VAERS, which is a vaccine adverse event reporting system through the FDA, so that they're aware of the adverse events if they're different. Yeah, as far as the safety behind the vaccines, we really have not seen complications in our hospitals coming in from that, unless there was something else underlining with those patients. We've been trying to find the characteristics and see bad outcomes, but really the vaccines are fairly safe.
Let's talk a little bit about the oral meds that now are, the CDC is approving certain oral meds, and what are we seeing regarding that? And is that something now that a lot of folks are possibly considering doing as opposed to getting vaccines?
Definitely, this does not replace the oral COVID medications are not replacing the vaccination process. We know that having the vaccines and the boosters right now are showing the greatest decrease in the incidence of severe infection and death, and what we call mortality. As far as the oral meds, we recently actually just got some in South Florida, very limited supply that are being distributed to our pharmacies. But we did get some in. What I'll tell you is there's a lot of adverse drug interactions that occur with some of these products, so we have to be very careful with our patients on what they're taking. Us as pharmacists really have to be, and as consumers of the medication, really need to be sure that we're aware of the risks of taking the medication. But it is there, and it's an available product. Right now, there's two. And they are going to be having, their EUA, emergency use authorization for them, and has criteria for who can take them.
Um, you're a tremendous resource. Obviously, this conversation we're having today is very important to our viewers and listeners. Um, what other resources are available for someone that just needs information, they need it timely? Where can they go? And the thing about it, I've seen, and I'm sure you've seen so many times, you can Google information, and you got to be really, really careful about the source of that information. There's a lot of good information, there's a lot of misinformation. So how does someone really determine whether what they're reading about or watch a video is accurate in terms of the conversation today?
Yeah, that's one of the biggest issues that we see, is that we're going straight to Google. I think the best thing is to go to reputable websites. Miami-Dade County COVID has websites that give you updates. There's a lot. You actually can look at the tracker with COVID medication trackers
Hmm.
and see which pharmacies have medications, et cetera. But definitely the CDC, the World Health Organization, are the two most reputable sites to look at as far as information, if you're looking for true valuable information. And it's actually spelled out in layman's terms, which is easy. So you're not really having a lot of medical terms in there. Definitely takes you to some of the studies. If you go directly into the website, we'll take you to some of the current study, the most up-to-date literature is there. And you could read the trials for yourself for these emergency use authorization drugs as well.
Um, in your field, I'm sure that you are constantly uh, talking to other colleagues, other pharmacists. What are they telling you? How has their experience been compared to your experience? Are you all kind of going through the daily ups and downs, the not knowing, the knowing, the change of information, the clarification? How are you all dealing with this? Because at the end of the day, the average person that is not obviously knowledgeable as you are, and the expert that you are in medication, how do they, how do you and your colleagues, how do you assess things, and what are you doing collectively? Are you sharing ideas? How is that world like?
Yeah, it's I can tell you that we're all in the same, when this first started, we were all talking to each other, and medications if we need it for our patients, we're very much sharing. We didn't know the knows. Every day something changes, so we have to be really up with the literature of what is being, published. EUAs or indications for use of medications change. How we give them, the route of administration changes from time to time. We have medications that started out as intravenous, and now they're given, intramuscular. So it changes the pattern of how you give these medications. A lot of it is focusing on the outpatient treatments of some of these patients to avoid, try to avoid those emergency room visits and the hospitalizations. So there's a lot of movement in that space, which I think is the right way to go, because we don't want to infect our patients coming in, least spread of the virus. I think the knowledge, we're, very lucky we have antimicrobial stewardship pharmacists on our teams, and in most of our hospital systems in South Florida. We're very lucky at Baptist to have one as well. And really just being on top of the literature and just informing everybody and kind of having those huddles. We do a lot through IDSA Instagrams, and kind of a lot of information as to what we're doing. And we ask those questions like, what are you doing here? Can you use this? Can you administer this with this? And pediatrics was one of the areas where I can tell you we really reached out to our colleagues in the pediatric space to find out if how these vaccines are working. What are we doing? What's different? But a lot of information sharing, a lot of trial and error of what happens. It all started from the vaccination process, and it's just been a community of help and everybody coming together.
Yeah, I'm obviously an average person that doesn't have the expertise in medication, but I observed and through the years, just watching and reading and talking to other medical professionals, that developing something like a vaccine that usually takes a few years to get all that, and we were able to get this done in a very, very short period of time. Does that lead to uh, not really knowing, or just kind of discovering in the process how these things work compared to other years where they've been tested and retested a million times? I know they had to expedite the testing of all of this to come out, and the timing of it there. Uh, but do you feel that we're going to know different information even 3 months from now?
I think so. I think we're seeing that now with the vaccines. I think we're seeing, changes to which one may have more of an effect with a variant and lasting effect and longer effects. As we go through the process of approval process of medications in general, I think that was one of the comments that I heard a lot while we were administering some of the monoclonal antibodies. Whether to take them or not, and this is, was rushed, and really nothing was rushed. It was just they worked overtime. So some of these medications and some of these formulary process for these medications, where they were already being studied or used or kind of looked at in other disease states. So for example, the monoclonal antibodies were used in, chemotherapy and rheumatoid arthritis. And then they just found that it was effective in this area. So it's not that some of the research was expedited. It was that it was there, and it was just kind of really reworked towards the virus.
Esty, any final comments as we close it off?
I think just be healthy, wear your masks, be able in the community, stay safe. And if you can, and get yourself vaccinated and boosted if it's indicated and you're able to get it.
Thank you so much. This is a great eye opener. And I thank you for your work, for your dedication, and all of your colleagues, and for sharing with us what I like to call the real information on what's going on with the vaccines and the boosters and everything. So thank you so much, and of course, always to Baptist Health for doing an amazing job keeping us well and healthy.
Thank you, Pete.
All right, take care of yourself. Bye-bye.
Bye.
That was great information that Esty Trimino shared with us regarding vaccines and boosters. So hopefully you've all been enlightened a little bit more, because as we know, there's information everywhere, but we just got to decipher which is the right information for our well-being. Thank you so much for being with us. Again, moving forward every Friday morning, 11 a.m. on our Facebook page of Camacol Doral, you will be able to see Camacol Talk, and we again focus on the leaders, the community leaders, the business leaders, and the small businesses in Doral and all of South Florida on this weekly video podcast. Thank you so much for being with us. You have yourself a fantastic week.